Hi, I'm Dr. Torino at EVMS, and I'm here for an EVMS Ultrasound Sound Bites on how to take care of your transducers and your ultrasound machine, specifically in the new situation we find with the requirements of the coronavirus. So first of all, really this session has two major objectives. First of all, to review the standard way and policy that we have regarding transducers and ultrasound machines, and then to present some published information for what are believed to be adequate equipment cleaning procedures in order to combat these concerns. Now, all sites acknowledge that these are new assessments and changes may come about. So I want to start with just giving you some of the basic terminology you will encounter as you look into the cleaning requirements for your specific machine. So the first is low-level disinfectant. Next would be high-level disinfectant. Then cleaning, disinfection in general, and sterilization. LLD is low-level disinfectant, and this would be what you use generally every day and for patients with intact skin. High-level disinfection is the next step up the safety chain. And that would require either a different type of a wipe or a soak. Cleaning really is just removal of soil from objects. In ultrasound, we want you to think about removing your gel. So you're cleaning your probe of any visual stickiness that has remained. Disinfection means you're going to clean most of the microorganisms except for some bacterial spores. So you should be cleaning and disinfecting really between every patient all the time. Sterilization is a process that for ultrasound is only required if you are utilizing invasive procedures. And sterilization of an ultrasound transducer can be accomplished via steam on some machines only, liquid soak, or certain UV machines. So in general, you are always going to wear a glove at least on your scanning hand. And you really need to take that pretty seriously. For one thing, as you're handling your disinfectants, they're not good for your skin to have repeated contact with. You want to use a probe cover if it's appropriate. And so anything that is invasive, anytime you're going to be scanning a patient that has visibly broken skin or has a high likelihood of contagion. You might not know, but perhaps they're coughing and feverish, and so then you're going to go into the encounter with the patient just automatically on a higher alert. When you're done scanning, you're going to wipe the probe with a soft cloth, the towel, or a washcloth, and then you're going to wipe it again with a wipe. You can also use several sprays, and you can spray and then wipe that also again with a soft cloth. And then after that, you are supposed to rinse or re-wipe, and then your transducer is ready for use. Please remember, these are very expensive components to your machine. Your transducers are really the heart of your machine. Never heat sterilize your transducer. That does mean that cleaning them can take more time than you might expect. So at EVMS, we use many different kinds of cleansers. Protex, Sani cloth, both super and plus, and then Cavi wipes. But in different departments, you're going to have different manufacturers, and you really need to look at the manufacturer's guide. And the truth is, even if we look at one laptop in lab, different probes on that laptop may follow different cleaning procedures, and it's based on the material on the outside of the probe. You never ever want to use any kind of wipe that has bleach in it. It will break down the outer protective covering of your probe and be quite costly to repair. So remember, you're really typically using low-level disinfection. Typically your patients are going to have intact skin. Now, it doesn't take away all the other items that you have to do to make your room safer. Get rid of anything that you don't need in there. Get rid of excess furniture. Anything that, in the case of COVID, that the virus could stick to. Use good hand hygiene. You want to wash your hands well before you start, and then well when you're finished. Wear gloves, especially if you are either handling a disinfecting material or working with a patient who does not have intact skin. Use a probe cover if you need to. Make sure you're applying it correctly. And then use your wipe or your spray as a low-level disinfectant. Wipe your probe dry, and it's ready to go. Only if skin is broken do you go to the next level of the pyramid, which is high-level disinfection. So there are really three categories that are considered in this discussion of how to clean medical equipment. And they really represent a low risk, a medium risk, and a high risk. And almost everything we do is going to be low risk. And for low risk, it's going to be a low-level disinfectant wipe. For mid-level risk, which might be and will include patients that have broken skin or semi-invasive procedures like transvaginal scanning, and then interventional procedures that are done on a patient with very low risk. In these scenarios, you have to use a probe cover. It's standard protocol. And then finally, high level risk, and these are transducers that are used in significantly invasive procedures like biopsies, drainages, anything else that will definitively break the skin. And this has to go through either a high level disinfection or sterilization, depending upon what the exposure is and how the transducer guidelines are written. So here's the real kind of painful rub. Anyone in ultrasound has known this was coming, and here it is. Now you should really put aside any bottles of gel. If you have bottles of gel that you use in very limited environments, perhaps they can stay. But at this point, all sonography should be done using single non-sterile packets of gel. If a invasive procedure will be accomplished and there will be definitive breaking of the skin, then you would use sterile gel. Don't forget the other thing we see on campus a lot. People will grab a wipe, but they just leave the lid up. And so several things happen. First of all, the wipes dry out. They are no longer effective. And secondly, any foreign infectants that are in the room can enter that bottle or that tub of wipes and infect that. So you really have to make sure you follow each task through to its end. And I decided that I would show you how you're going to clean a transducer, assuming you can use an LLD wipe or spritz of a cleaner. So Protex, it's well known for being very easy on the outside material of transducers, but you would have to wipe your, you'd have to wipe your probe and then wrap your probe in damp Protex wipes and leave them in place for 10 minutes before the probe could be used again. When we go to faster acting cleaners, you have Cavi wipes. They have, in this case, your probe has to be wrapped for 3 minutes. And then the purple Sani wipe, and that is the fastest acting, and that requires 2 minutes. I do want to point out to you that each of these wipes have been registered with the EPA, and each of them have been evaluated as containing an appropriate ingredient for killing the majority of viruses and killable bacteria. So that's a lot of time. And even here, as I'm getting ready to wipe and wrap a probe, you might not realize how much time is involved. And this little clock on this presentation is going to jiggle for 2 minutes. So for 2 minutes, I am going to wrap this probe. Don't forget, when you wipe it, you have to wipe all of the cord as well. So I'm going to wrap all of the probe that would potentially have been in contact with a patient and leave it. If you are required to use a high-level disinfectant, you can use a soak like Sidex. We have Sidex in our labs. So there you can see just how long your 2 minutes are, and that is for the quickest of the low-level disinfectants. So we want you to remember you really need to set a clock. It's much longer than you think it will be. And in the end, what we want you to remember is to use best universal precautions to take care of your own safety and welfare, to use single-use gel packets, and to clean your probe and your machine well, including your cords after each use. You should, may I go back to my machine for a moment, please? Once you have wiped your probe and your cord, once you've wiped your cord all the way to the machine, you really need to wipe every other transducer, the entire surface of the keyboard structure that you likely brushed against while you were scanning, around all of the buttons and the monitor, because not everybody, but I know that I am a particularly bad person about pointing and touching my probes. So you need to remember that you're going to follow your best precautions and clean every inch of your machine. Can we go back and I will finish? And that is it for this presentation. Oh, I can't make it go forward. It won't move. Ah. Oh. that's it for this presentation from EVMS Ultrasound Bites, and we want you to scan safely and take care of your patients. Thank you.